Hello and welcome to another session on our rabbits webinar. This one is going to be based on how to find a rabbit savvy vet, what to look for in their waiting room, and also how to examine your animal at home. Particularly important for rabbits, especially during the current sort of crisis with the COVID-19 issue around the world, and certainly at the moment it's very difficult to have routine appointments with veterinary practices, but with the aim that if you can check your rabbit regularly at home, you will make sure that you are on top of things should anything become an emergency situation. So where to find a rabbit savvy vet? There are two main websites to look for. You've got the Rabbit Welfare Association and Fund website, which you can go on and click to find a vet. There's gold and silver standard vet practices. In order to be gold standard, you have to have an advanced practitioner or a BERF with also the suitable environment in the practices as well. What we're looking for with those is to have a separate waiting area for the rabbits and also separate kennel area, as well as the equipment that we have available for the rabbits there. We are gold standard at Origin Vets, certainly in the Cardiff practices, and this is something that we try to maintain the same standard throughout. It's just the other things to sort of look at really would be to the Royal College of Veterinary Surgeons on their website, where you can find advanced practitioners and also European specialists as well. Many advanced practitioners are going on to become European specialists, so just bear that in mind as well. So when you're looking in your waiting room, ideally what you're looking to find is that they've created an area that's away from predators, which does include cats and dogs and ferrets, birds of prey and snakes as well. Hopefully there'll be a visual barrier, which will mean your rabbit won't see them, and they've created an area which means off the floor, so that you can place your carrier with your rabbit on, and ideally there's a towel provided which you can spray with Pet Remedy. This is a sort of a spray compound which creates a calming atmosphere for the rabbit and makes them much calmer for examinations. So this is our gold standard waiting room in our Cardiff practice. We've got visual barriers here, so they can't see any potential predator animals around them. We've got tables to put the carriers on with towels to go on top. So when you're looking at your vets, have a look to see if you've got separate area, if you've got raised areas to put your basket on with towels to cover them, still allowing ventilation, but to reduce the visualization. So how do we examine your animal? And this is what a lot of this is what you can do at home. Be very careful when you're handling for examinations. You may find that you may need to do this bunny burrito, which is where you keep the animal nice and secure, and just bring one leg out at a time and have a little look at things, and for carrying them around if they don't particularly like being carried. Remembering that rabbits are prey species, and then their desire, when they're being picked up, their thought is that a bird of prey potentially is coming down to take them off, and therefore they don't like being handled. But that doesn't mean they don't enjoy company, and they certainly do love being groomed, and many rabbits will bond with the owners and will have mutual grooming for the rest of their bonded lives. So when we're handling them, we really want to support the spine. We need to make sure there's one hand under the rump at all times, and that the other hand is towards the front, protecting the head. You can also often tuck the head under the crook of your arm as you're carrying around, ensuring that they can still breathe adequately, no pressure on the chest, but prevents them from jumping off. If you do have nervous animals at home, then either consider putting them on the floor or using a bunny burrito on the floor as well. So this can go for if anybody is examining rabbits that are neurological, they've got pre-existing head and tilt issues, or just nervous rabbits, then do it on the floor. So the first thing you can do at home is to do a body condition check. There's a typical petimeter score, which I'll run through in a second. If you do this weekly on your own rabbit, you will be able to pick up on subtle changes before it becomes an emergency. Many rabbits can be overweight, but can actually have a poor body condition, which means they can weigh quite a large amount, but they have very little muscle tone. Okay, these are both mini lops, and as you can see from this one here, you can see right underneath the rabbit, nice clean visualization underneath there. The rabbit's sort of looking up and looking around, sat on all four legs there. This is also a mini lop, but is become so obese that it's unable to stand safe adequately, that you can see underneath the floor there. So the rabbit size-o-meter, what we do is score them between 1 and 5, 3 being ideal, where we can the hip bones and ribs are easily felt, but they're rounded with good muscle tone, and they don't have any sharp edges. There's no abdominal bulge underneath, you can see easily under there. They say the ribs should feel like a pocket full of pens, so rather than sticking out such as in 1 or 2. So whereas 4 and 5 are becoming overweight, so 5 being obese, where it's pretty hard to feel the spines or hip bones, and the ribs certainly can't be felt with a saggy tummy. And then on the other end of the spectrum, you've got very thin rabbits, where you've got that hip bone and the ribs are easily seen. There's no sort of muscle coverage, or very limited muscle coverage, and very little fat coverage. So really what you want to be aiming for is this 3 here. That's the ideal. So this, the integument, which is looking at your coat and skin, you should check this certainly on a weekly basis, but in the summer, particularly on a daily basis, check the back end around the rump area. The fur should be clean and dry. There shouldn't be any knots there. Depending on the breed, it should be quite soft to touch. There shouldn't be any erythema, which is reddening of the skin. So in this area here, you can see the skin's quite pink there. You shouldn't be any crusting or scaling or any odour. Should not be any urine staining for around the back legs, particularly down the legs there, or around the genital region. There shouldn't be any feces accumulated, so you should have a nice clean bottom area, and there should not be any wetness in this area. If you have any of these, this is abnormal, and it can predispose to fly strike coming in, particularly now we're hitting fly strike season. So please ensure you do seek veterinary advice if you do have any of these problems. You can check the hydration status, lifting up around the sort of skin around the neck there very gently to see if it's springing back nice and easily. Dehydrated animals will have sunken eyes. They'll lose the skin elasticity, so the skin will sort of stay up if you gently pull it up. You can check also around the ear base as well. The hairless area around the groin region. And if you've got an entire male, then the scrotal sac is a good one to check for dehydration state. If they've lost weight rapidly, that will also indicate that there's dehydration. So if you are regularly weighing them at home and you've suddenly got a weight loss, they are going to be dehydrated, and you really should seek veterinary advice. So CVS stands for our cardiovascular system, and what we're looking at here is basically things which would indicate cardiac issues, problems with the heart and with the vascular system, with the blood flowing around the body. What you want to look for is that the mucous membranes, so that is the nose around here, just by the lips and under here, just gently pull back on those lips. When you're examining the mouth here, avoid to pinch in the nose, because they are what we call obligate nasal breathers, so they cannot breathe through their mouth at all effectively. They can only breathe through their nose, and if you're pinching on the nose, they will start to panic. So when you're examining the mouth area, keep the head nice and level. Don't tilt it upwards, because that will cause problems. Keep it nice and level. Open the lips slightly, and you'll see the lovely pink colour. Bearing in mind that some of them, like in the steel blue colours, can look naturally slightly grey around the lips, so always check the gums around the teeth. They should be slightly pale pink. If you're seeing bluing around the gums, then it's called cyanosis, which is a problem where we're lacking oxygen in the body, and your rabbit needs to seek a vet urgently. If they're very pale or white, it can indicate things like shock or anemia. So an unwell animal or an animal that's had any problems with collapse or recently had an attack from a predator. So unless they're collapsed, the vets will generally sort of check all this at the same time as checking the mouth as well. Obviously at home you can't check at the back of the teeth easily, but I'll show you what we do in practice. You want to check the heart rate and pulses. So if you feel just behind the elbow into the chest, you will feel the heart rate of your rabbit, and normally you'll feel that's very, very fast. If you do this on a regular basis, once a week, having a little check there when they're having some bonding time with you, you will start to feel what's normal for your rabbit. Arrhythmias are an abnormal rhythm. Now, you may not be able to count the heart rate, but you certainly could start picking up if you've got abnormal rhythms coming in, if you're used to regularly checking. So respiratory, this is our breathing system. Remembering that the nostrils will twitch and move, and that does not equal the respiratory rate. So don't count the nostril movement when you're looking at the respiratory rate, okay? What you want to look at more is the pattern and the effort that your rabbit is making to breathe. Then the nostrils should be open, there should not be any discharge coming down, and you should have equal airflow through both sides. So that's easy to check at home. Little finger in front of both nares and just check you've got equal breathing coming down in the airflow. Normal breathing is short and rapid, it's regular with very minimum effort. Abnormal breathing, you'll often be prolonged, so they're taking in deeper breaths. It'll be slower to allow them to breathe more. You may hear crackles or wheezes of the breathing. You may find that certain aspects, they're trying to breathe in but very little sound. And the main thing is a much increased effort. If you notice any signs of respiratory problems, again, this is a time that you need to contact your vet and get them in to be seen. If the rabbit is open mouth breathing, then that is an emergency and you must seek veterinary advice. Okay, so looking at the ears, we've got the upright ear versus the lop ear, okay? Upright ears generally don't have much of a problem with the ears at all, but it's always a good idea to just check, open them out, check there's no sign of any mites or crusting, and also have a little look down the ear canal. You do not need to put anything down the canal, no cotton buds, no fingers, just have a little look. Some wax may be normal, but they should not look red or inflamed or signs of any pus. You may be able to see down to the tympanic membrane, but it's very, very unlikely in the vast majority of rabbits. So this is what your vet will be looking at when they look down the ears, and they should check the ears every time. The tympanic membrane is normally white and relatively translucent, whereas otitis media, which is infection in the ear, your vet will notice that there'll be bulging or discharge coming from that tympanic membrane. You can also examine the base of the ear, so certainly around all this area here, for any signs of swelling or pain that may indicate an ear abscess. Lop-eared rabbits is exactly the same situation, but they do tend to have more problems with ear issues. There was a recent study from the Royal Veterinary College, which has indicated that sadly many lops do have many more dental disease problems and much more problematic with their ears. It's to do with the fact that ears are folded down, which changes the shape of the skull. And it means then that the ear cannot easily clean itself. Okay, so checking the eyes, we want to look in various different areas. So the globe is the eye itself. We want to make sure there's no signs of trauma or swelling. You can check this on a weekly basis. We want to look at the conjunctiva, which is just gently moving down here, looking at the areas all the way around underneath those eyelids. The lacrimal duct is the duct which goes from the eye, just in the corner of the eye, and it runs down over the premolars root, and then comes back up over the incisor root and out through your nose. Effectively, it's how the tears flow, and it's why if we do cry, we have a runny nose ourselves. There should not be any discharge coming from there, so if you press it gently on the globe above it, you will see that there should not anything coming out. If you are seeing white discharge or lots of inflammation, then again, you need to seek veterinary advice. Check the eyelids for any signs of damage or swelling, and the periorbital region means just checking all around the eyes here that there's no sign of trauma or swelling or infections. So the gastrointestinal system starts at the mouth and ends with the anus. With the mouth, we want to be checking the teeth. Now, in practice, as your vet sees your rabbit, they'll be checking inside, checking the palate and the tongues and the cheeks inside as well. You won't be able to do this, but you will be able to check with the incisors and feel along the face. So what we want to do is feel along the bridge of the nose from the nostrils right up and going out towards the eyes either side here. Gentle palpations, all you need to do. We want to feel along, so that's the maxilla. We want to feel along the mandible, so that's underneath, and we're feeling right from again, the front incisors right along the jawbone. Now, if you feel your own jawbone, this is lovely and smooth, and then as you get just to the base here, which effectively is this bit on the rabbit, you'll feel a little bump called the ramus of the mandible, and that's normal. But if you're feeling bumps in front, then this can indicate that the teeth are actually abnormally growing down. The zygomatic arch is this area up here, so you want to feel then just underneath the eye and run in between the where the lower jaw and the upper jaw would meet. This is how we check the teeth in practice. We use a little oroscope, just gently hold them behind the nostrils, and we just pop the oroscope in this to the side of the incisors, and we check those teeth inside both sides, top and bottom, checking the tongue and checking the palate and the cheeks. Again, this is the incisor check here. So if we look here, this is our normal, and this is a lovely pink coloured rabbit there, avoiding the nostrils when we're examining the nose. You can see lovely in pink, normal incisors. This is abnormal incisors. These are congenitally abnormal incisors where the lower jaw and the upper jaws are inadequate length. This is very typical, unfortunately, with things like mini lops and Belgian dwarfs and other Netherlands dwarfs, and where the nose has been pushed in, and therefore the same number of teeth but with less space can cause problems. These normally need to be removed, but you do need to speak to your vet if you are noticing things like this. It is quite important to speak to your rabbit vet. So following on into our lower part of our gastrointestinal system, we can examine the animal's abdomen at home. The stomach is soft and it's compressible, and by cranial we mean it's towards the front end, towards the head of the abdomen rather than towards the bottom side of the abdomen. It's also slightly to the left as well. The cecum, which is the main factory for doing all the fermentation, is also large and soft, and it's towards the midline and to the right. The colon is small, it often has firm pellets. It's caudal, which means towards the back end of the abdomen, and dorsal, so towards the spine. And we can listen. So in practice, we will be listening to all four areas on the rabbit. So top, cranial left and right, and caudal left and right, to listen for normal gut sounds. But at home, you may not be able to do this. If you do have a stethoscope, then by all means listen on a regular basis. But you might just suddenly notice lots of gurgling sounds coming through and your rabbit's a bit uncomfortable. So if they have abdominal issues, many rabbits will press their stomach against the floor. They'll be stretching out but look uncomfortable rather than a relaxing stretch. They may go off their food very quickly and their feces size will change. Remember that rabbits produce around about 150 fecal pellets per 24 hours. They should be all relatively consistent in size, shape, colour and texture. So if you are having changes, whether that be a reduction in size or none at all, whether you are seeing a difference in numbers, colour, texture, then you really need to speak to your rabbit vet. And if there's no feces at all, that is an emergency and you must get seen by a rabbit vet ASAP. And then obviously we want to check around the anus and the back end to make sure that everything is nice and clean. So this is the back end here. This is a female. The anus is here and the vaginal opening is there. We are checking all around the skin at the same time, making sure, as we mentioned earlier, no sign of urinary staining or anything. So in this case, we might want to just gently hold the rabbit so that we've got the back end on a table or on the floor between us, and we're supporting the front end as well. At this point, we can check the genitalia. We're looking to make sure if you're sexing the rabbits that we've discussed before, that whether it's a male or female. We want to make sure there's no swellings or discharge. If it's an entire male, then check that the testes are smooth and symmetrical, with the penis being smooth and pink and the vulva being nice, clean and pink if it's a female. With a female, you want to check the mammary chain as well, so the nipples running down either side on the belly. Make sure there's no lumps or bumps there. You may be able to feel the kidneys, but this is more what we would feel in practice. It's not something that owners would generally feel at home, but certainly in practice we would be feeling the kidneys and the bladder as well. So this is a normal genitalia area, and just a reminder, this would be abnormal. You can see here we've got swelling, we've got urine discharge, we've got crusting, we've got red areas around here and some feces on the sides. So if you're seeing this, you really need to speak to your rabbit vet. So musculoskeletal system is looking at our muscles and our skeleton. To assess this, you want to just watch your rabbit walking and hopping and running to assess what we call their gait, to make sure nothing's changed, they've got no lameness and they're not favouring any legs. You can palpate down all 4 limbs, including the feet, checking that there's no signs of trauma, no signs of infections or swelling, particularly looking at the foot pads, that there's no sign of pododermatitis, which is infection and inflammation of the feet. You can palpate around the neck and just gently tilt that neck, make sure there's no sign of any pain. Anything that you do with your rabbits must be slow and gentle. You can assess the muscle tone as part of your body condition scoring on your rabbit. So the lymphatic system looks at our lymph nodes. The easiest ones to feel are the popliteals, which are behind your the rabbit's kneecaps on the back aspect of their leg, on the hind legs. Some experienced rabbit owners will be able to feel these. Otherwise, this would be something that your vet would be checking on examination. And then finally, coming on to nails and clipping your nails, keeping the rabbit's nails at home. Generally, cat or dog nail clippers are adequate. You may find human nail clippers may be easier for the very small breeds. What you want to do is just have your rabbit resting on the floor, or if you do have a table, then just make sure that it's on a non-slip table, and just gently holding the one front leg out and clipping the nails one at a time, and then for the back legs, just holding them out as well. Avoiding putting too much pressure to stop the rabbits panicking. If you do have a rabbit that is nervous or tends to be a jumper, then you may want to use the bunny burrito as we showed in the towards the beginning of this session. Well, thank you all for listening. I hope you are more confident in checking your rabbits at home so that we can pick up on problems before they become a major issue. If you've got any concerns at any point, please speak to your local rabbit savvy vet, and they can direct you in the right direction there. I do thank you all for listening, and again, you can follow us on Origin Vets on Facebook and Instagram, and the Rabbit Welfare Association Fund, and on YouTube. Take care now. Bye bye.